Hi, I am Dr. Mangesh Kamath. I am a senior consultant medical oncologist, hemato-oncologist, and bone marrow transplant physician practicing at Healius Cancer and Hematology Clinics, Bangalore. Around 60% of all cancer patients are known to be above the age of 65-year-old. So, do we just not treat them even if they come at the early stage? That is a question that not only the doctors but even the relatives of the patients ask us. It is important to know that we will get a large majority of cases such as prostate cancer, breast cancer, lung cancer, and many other types of cancer in the age group after 65 years. So, what we do as oncologists is that we do a comprehensive geriatric assessment of all the patients. So, a 70-year-old patient may be physiologically a 50-year-old or maybe physiologically even a 90-year-old. So it depends on how the individual has taken care of himself or herself during the entire lifetime, the habits that the individual has and had, and also the comorbidities such as diabetes, heart disease, COPD, and hypertension, many such disorders that the individual may be suffering from. We also look at what are the treatments that the patient is already undergoing for different diseases. We look at the psychological well-being of the patient, the neurological status of the patient. That means whether the patient is able to otherwise carry on all the activities of daily living without any difficulties or not. So after this assessment, then we plan for the treatment of the patient. So if a patient is very well preserved, then we treat this patient like a middle-aged patient. And if the patient is in a curable state, we make sure that the best treatment is given so that the patient can be cured of cancer. If the patient comes in an advanced stage, then we look to reduce the symptoms due to the cancer for the patient and also give treatment such that the death due to the cancer can be delayed as much as possible and the patient can live longer than at the time of the diagnosis without treatment. Now remember folks, it is also important for us to remember that as per today's statistics, a 75-year-old patient without any disease is expected to live 6 more years without any issues. And an individual at the age of 85 is expected to live for 4 more years without any issues. So why should we deprive these patients with cancer of any treatment? Especially if they are curable, especially if they can live longer with treatment. So there are a lot of treatment protocols that are being designed for treatment of cancer in the elderly. So much so that there is a branch of oncology called as geriatric oncology. So I have a lot of patients with cancer beyond the age of 65-year-old. Barring a few exceptions, I do treat them with lot of care so that they don't get side effects from treatment. And with the advent of today's treatment such as targeted therapy and immunotherapy, we are definitely moving towards the stage wherein we can treat even elderly patients with cancer with the same intensity as we do for the younger patients. Thank you.